Symptoms of liver failure. Welcome to Health Life. Liver failure is a life-threatening condition that demands urgent medical care. Most often, liver failure happens gradually, over many years. It's the final stage of many liver diseases. But a rarer condition known as acute liver failure happens rapidly, in as little as 48 hours, and can be difficult to detect at first. Liver failure happens when large parts of the liver become damaged beyond repair, and the liver can't work anymore. There are two types of liver failure. Acute. This is when your liver stops working within a matter of days or weeks. Most people who get this don't have any type of liver disease or problem before this event. Chronic. Damage to your liver builds up over time and causes it to stop working. Overview. What is liver failure? Your liver performs many important functions, including making blood proteins that aid in clotting, transporting oxygen, and supporting your immune system, manufacturing bile, a substance needed to help digest food, helping your body store sugar, glucose, in the form of glycogen, ridding your body of harmful substances in the bloodstream, including drugs and alcohol, breaking down saturated fat, and producing cholesterol. Liver failure occurs when your liver isn't working well enough to perform these tasks. Liver failure can be a life-threatening emergency that requires immediate medical attention. How common is liver disease overall? In the U.S., approximately 30 million people have some form of liver disease. More than 8,000 people in the U.S. received liver transplants in 2017, and more than 17,000 people are on the waiting list for a liver transplant. What causes liver failure? Viral infections, such as hepatitis B, the overuse of certain drugs or toxins, like acetaminophen, Tylenol R, and the use of other medications, including certain antibiotics, antidepressants, anti-seizure medications, man-made hormones and antifungal drugs, and herbs, green tea extract and kava, metabolic, biologic, or vascular, vessels that carry fluids such as arteries, disorders such as Wilson disease, and autoimmune hepatitis. What are the symptoms of liver failure? Hepatitis B. It makes your liver swell and stops it from working the way it should. Hepatitis C. If you have it long-term, it can lead to cirrhosis. Long-term alcohol consumption. It also leads to cirrhosis. Hemochromatosis. This inherited disorder causes your body to absorb and store too much iron. It can build up in your liver and cause cirrhosis. Other conditions that can lead to liver failure include hepatitis A, contact with food or water contaminated with the hepatitis. A virus, or with a person who's infected with virus, can cause liver inflammation. This type usually goes away on its own. Autoimmune hepatitis. In this type, your body's immune system, not a virus, attacks your liver and causes inflammation. Cirrhosis. Things like drinking alcohol for many years or having hepatitis scar your liver can make it hard or impossible for your liver to work. Primary sclerosing cholangitis. This disease slowly damages your bile ducts. It mostly affects young men. Oxalosis. This is when your kidneys can't get rid of calcium oxalate crystals through your urine, and it spreads to other parts of your body. Wilson's disease. People with this rare inherited disease store too much copper in their brain and liver. Alpha-1 antitrypsin deficiency. This genetic condition can lead to lung or liver disease. Liver cancer. People with long-term hepatitis B or hepatitis C often get this. Fatty liver disease. Extra fat cells can build up on your liver. Non-alcoholic fatty liver disease often affects people who are overweight, obese, or have high cholesterol. Alcohol-related fatty liver disease affects heavy drinkers. Primary biliary cholangitis, PBC. Over time, this disease destroys your small bile ducts. You might still hear it called by its former name, primary biliary cirrhosis. Galactosemia. People with this condition can't process galactose, a sugar found in many foods. It can cause liver damage. Liver disease diagnosis and tests. Tests and procedures used to diagnose liver failure and liver disease include blood tests. These let your doctor know how well your liver is working. You might get a prothrombin time test, which measures how long it takes your blood to clot. With acute liver failure, blood doesn't clot as quickly as it should. Imaging tests. These take pictures that let your doctor see what's going on in your liver and figure out what's causing the problem. They may recommend ultrasound abdominal computerized tomography, CT, scanning, magnetic resonance imaging, MRI, biopsy. The doctor will use a needle to remove a small piece of liver tissue and look at it in the lab. A transjugular liver biopsy is a special procedure that lets the doctor put the needle into a vein in your neck. Management and treatment. How is liver failure treated? Liver disease and liver failure are usually treated by specialists called hepatologists. Treatment of liver failure depends on whether it is acute or chronic. For chronic liver failure, treatment includes changes to your diet and lifestyle, including avoiding alcohol or medications that can harm your liver, eating less of certain foods, including red meat, cheese, and eggs, weight loss and management of metabolic risk factors, including high blood pressure and diabetes, cutting down on salt in your diet, including not adding salt to food. You may also receive a blood transfusion if you are bleeding excessively, or a breathing tube to help you breathe. What complications are associated with liver failure? Liver failure can affect many of your body's organs. Acute liver failure can cause such complications as infection, electrolyte deficiencies, and bleeding. Without treatment, both acute and chronic liver failure may eventually result in death. Prevention? Can liver failure be prevented? You can reduce your chances of developing liver failure by being vaccinated for hepatitis. B. Cutting down on alcohol consumption. Maintaining a weight that's healthy for you and active lifestyle. Following directions when using medications like acetaminophen, Tylenol R. Having a physical examination every year, at least, with a primary care provider, with screening for obesity, high cholesterol, high blood pressure, and diabetes. Who is at the greatest risk for liver failure? People most at risk for liver failure include those who have chronic, long-term liver infections like hepatitis B or C, drink or have drunk alcohol excessively, have pre-existing or acquired medical conditions that make liver failure more likely, such as hemochromatosis, your body absorbs too much iron from food, non-alcohol-related fatty liver disease, a large amount of fat in your liver related to the metabolic syndrome, autoimmune disease, your body's own immune system attacks your liver, and Wilson disease, your body cannot remove extra copper. What is the outlook for patients after treatment for liver failure? Many people recover from liver failure with treatment. If a transplant is necessary, most patients go back to their daily activities within 6 months. People who have received a transplant need lifelong medical care, including medications to prevent their body from rejecting the new organ.